My practice is called Glenpark Medical Centre. It's in a fairly deprived area of Gateshead called Dunstan. I've worked here for about 15 years and we've always been really proud of our long-term condition management. Until a few years ago, we were quite doctor-centred and we worked in quite a siloed fashion. So we had a doctor and nurse who specialised in diabetes, a doctor and nurse who specialised in asthma, and so on for most of the chronic conditions. And patients would come to disease-specific clinics. We always did very well with our QOF points, but a few years ago this term multi-morbidity started being discussed and person-centred care, and we realised that perhaps this was not the best way to be working and that perhaps we should look at changing things. We'd heard of the Year of Care partnerships and their way of monitoring long-term conditions using care and support planning, and decided that we would like to try doing that at our practice and combining it with multi-morbidity clinics.
The CCG entered into the care and support planning project with our member practices because we wanted to find a better way to engage patients with long-term conditions in their care. We saw the benefits of them as supporting them to self-manage that would ultimately give them a better understanding of their condition. One of the main benefits introducing the care and support planning approach into general practices offered is the opportunity for practices to take a more than medicine approach to care and link their patients into wider community activities that can support their health through social prescribing.
So when I first started Glenpark, I came in as an apprentice, and over the last 4 years my role's kind of grown within the practice to where now the long-term conditions have a lot more to them, and the social prescribing has grown as well. For training within that, I've had, for the long-term conditions, Dr. Haines has helped us out a lot. I've also been to a few different timeouts with other practices and we've gone through things there. And within social prescribing, we've kind of done the same thing. So we've gone out and done meetings with the other care navigators and social prescribers, and we have a network of all the emails that we can go to if we're struggling for anything. Everybody's on there as well. Within social prescribing, if a doctor or a nurse feels like a patient needs some help socially for any reason, they would send me a message and I would contact the patient and ask them if there's anything that I could help them with. I usually give them about a week's time frame to get back to them, and within that time I'll have a look for anything they need. If it's anything like befriending, I've always offered a service where I could go along to the group that we have, the Thursday group, and meet them there and take them in for the first time if they're nervous. And I've also had a few patients come in and give feedback to the doctor or the nurse that's referred them to say that it's changed their life for the better and it has really benefited their outlook on life.